Why are drug-resistant STIs more expensive to treat? Have you ever wondered why treating drug-resistant sexually transmitted infections can be so costly? It turns out that the complexity of these infections significantly drives up treatment expenses. When a strain of an infection becomes resistant to standard antibiotics, like ceftriaxone for gonorrhea, the first treatment often fails. This leads to the need for additional medical visits and alternative therapies, which can be more expensive. One major factor contributing to higher costs is treatment failure. When the initial antibiotic does not work, patients must return for further evaluation. This often means they will require second-line treatments or alternative medications that are typically pricier. For example, treating ceftriaxone-resistant gonorrhea can add around £190 and 54 pence per patient due to the need for retreatment and more intensive management. Additionally, healthcare providers may need to use more expensive antibiotics or even a combination of treatments. Gentamicin, for instance, is an alternative to ceftriaxone, but it comes with higher initial costs. It only becomes cost-effective if ceftriaxone's effectiveness drops significantly due to resistance. Another factor is the need for additional diagnostic testing. Managing drug-resistant STIs often requires antimicrobial resistance point-of-care testing. While these tests can increase upfront costs, they help avoid ineffective treatments and improve overall outcomes. For example, implementing antimicrobial resistance testing strategies for gonorrhea can lead to better treatment results, even if the initial costs are higher. Patients with drug-resistant infections may also need more follow-up visits and monitoring for complications. In some cases, hospitalization may be necessary if the infection spreads or causes severe symptoms. All these additional healthcare services contribute to the overall costs of treatment. Moreover, the societal and public health costs associated with drug-resistant STIs are significant. These infections can increase the risk of ongoing transmission, which requires extensive public health interventions, contact tracing, and educational efforts. The broader economic burden of resistance adds to the individual treatment expenses. In summary, drug-resistant STIs are more expensive to treat because resistance leads to treatment failures, necessitates costlier alternative medications and diagnostic tests, increases healthcare visits, and imposes broader public health costs. Effective management requires careful antibiotic stewardship, timely resistance testing, and adherence to treatment guidelines to minimize resistance development and control costs. Always consult a healthcare professional for personalized medical advice.